this is a concern because tuberculosis is a highly infectious bacterial disease.
The Montreal Regional Public Health Department has recorded an increase in tuberculosis cases in the Montreal region. In January, there were 21 confirmed cases compared to an average 11.5 cases per month in 2023.
Whenever you see it, you have to do some investigation to determine who else could have been infected by that person who is infectious, and because you want to try to prevent those people who are exposed from themselves going on to ultimately develop active tuberculosis infection.
Montreal Public Health has confirmed that most of the 21 cases in January were transmitted to people infected outside of Canada before coming to Montreal, and that currently in the city around 90% of the cases were acquired abroad.
This is a disease that has a lot of connection with people's socioeconomic status. So Canada historically has very, very low levels of tuberculosis compared to most other countries around the world. But worldwide, roughly 30% of the global population has actually been exposed to tuberculosis at some point.
Tuberculosis generally affects the lungs and in some cases, if left untreated, can be deadly. Dr. Matthew Oughton, an infectious disease specialist at the Jewish General Hospital, says Montrealers shouldn't be overly concerned with the increase in cases as they are still at a relatively low level. TB symptoms include fever, cough, and weight loss that can be similar to other infections, so a tuberculosis diagnosis is difficult without a specific test.
If you know that you have been exposed to tuberculosis, or if someone with whom you live and share sort of close proximity with has been diagnosed by a doctor with tuberculosis, then you really should get medical attention to find out where you're exposed.
In Montreal, Gareth Madoc-Jones, City News.